So, hi everybody, we're here with one of the practice nurses within the Federation. I'd just like to introduce you to Michelle. Michelle, could you tell us a little bit about yourself, please?
I'm Michelle, I work for the Federation, but I'm also a practice nurse locally and I have been for 20 years. At the minute I work at Abbey Medical Centre. I've been a nurse for over 30 years, actually 32 years, but practice nursing for about 20 years now.
Super. Okay, and so you've done some work within the extended access service.
Yeah, I've done some weekend and some evening work.
Okay, and so can you tell us what type of procedures that practice nurses can do in extended access?
Yeah, sure. Ideally treatment room.
Okay.
Anything that you would class as treatment room nursing. So that's cervical smears, removal of sutures, some very basic dressings, injections, baby-ins, anything really like that. No chronic diseases, so no asthma reviews, diabetes, COPD. We can also do contraception, the basic checks on pill checks.
Super, okay. So at the beginning of the service we had quite a lot of dressings booked in with the practice nurses that were inappropriate. Can you tell us what makes it inappropriate?
Okay, so the appointments are 15 minutes, which is brilliant if you're doing an injection or so a B12 or a pill check. That's a really good appointment slot and time to be able for you to do that. It isn't that good to do complex dressings, so we were getting leg ulcers that needed compression. You're going to need at least 20 minutes for bandaging, let alone soaking the leg. We were getting really complex dressings that really needed to be seen in their own surgery. Sometimes the dressings weren't coming with the patient or the correct dressings.
So dressings, they would be inappropriate because you don't have the equipment needed for complex dressings. Okay. So how do you think we can increase appropriate use of these appointments then?
So I would say about pushing cervical cytology and screening towards the service. That would be brilliant. A lot of ladies, they perhaps are working or they've got young children, so evening appointments would be really good and weekend appointments would be excellent to utilisation for smears. Every nurse that works for extended access can do cytology, they can do their smears, so that would be really, really good. As a practice in Kenilworth, we actually did we targeted our overdue patients and we tried to direct them towards extended hours. Whether anybody took that up, in our invite letter we actually had that we could offer appointments at evenings and at weekends. So that would be really good if surgeries took that on. Every surgery needs to uptake increase their smear uptake. So that would be a really good way to do it without having an impact on your Monday to Friday general nursing appointments.
Oh, super, that's a great idea.
Yeah.
Thank you very much, Michelle.
That's all right.